Hi there. In this video, we're going to be talking about type 1 and type 2 diabetes mellitus. Okay, type 1 and type 2 diabetes mellitus is something that's related to the production of insulin and the pancreas. So we're going to be talking all about it today and the differences between those two types. So in real life, when we look at diabetes, there's actually three different forms. In chapter 13, we're going to be talking about two of the different forms. Today, we're focusing really just on diabetes mellitus, and we're specifically focusing on the pancreas today. So diabetes mellitus is related to insulin, remember. Okay, normally insulin, after we eat a meal, okay, and the blood glucose levels rise, insulin will be released, and we will have three options. We either put the glucose that we have in our blood either in the cells to be used up for cellular respiration, we store it in the liver and the muscles as glycogen, or we put it in fat tissue. Okay, so those are three options, and that will bring our blood glucose levels back down to a normal homeostatic level. Okay, for someone who has diabetes mellitus, which is a genetic disorder, okay, they unfortunately cannot produce insulin, or they cannot produce enough insulin, depending on the type 1 versus type 2. And I'll talk a little bit more about that on the next slide, from their beta cells in their pancreas. So for whatever reason, and I'll explain that on the next slide, there's a couple of different reasons why this can happen. They are not able to produce enough insulin for their body to actually bring their blood glucose levels down back to a normal level. So this means that their blood glucose levels are always going to be really high after they eat, which we could call hyperglycemia, okay, which means that they have high amounts of glucose in their blood. And this allows for glucose to end up in the urine. So your body thinks, okay, we have all this extra glucose in the blood, so obviously I don't need this much, so I can just pee out any of the excess, because otherwise it would be in the body cells, or be in the liver, or be in the fat. So they end up just peeing it out in your urine. And then what happens with that is, because your kidneys are in charge of making sure that you have certain concentration balances, because there's so much glucose concentrated in the urine, water will follow into the urine as well, which means that you're going to have a large volume of urine being produced every single day, because it's trying to even out that concentration balance with glucose. So someone who has diabetes mellitus, lots of different symptoms, but some of the things I could talk about is they're going to have frequent urination with lots of urine every single time, but they're also going to be constantly thirsty because they're ending up peeing out a lot of their water. Okay, they're going to feel really, really, really thirsty. Okay, because they don't have insulin to put any of that glucose into their cells, they're going to feel really lethargic and tired and not have much energy, because their cells are craving glucose. And for whatever reason, okay, whether they're not producing insulin or they're not producing enough, or maybe their cells are actually like not allowing the insulin to work, okay, they're not getting glucose into their cells, which means that they're like, how do I do cellular respiration? Well, they'll resort to breaking down fat molecules or protein molecules in order to actually get glucose, because you just need 6 carbons and 12 hydrogens and 6 oxygens in order to get a glucose molecule. So they'll find glucose other places, okay, from other types of nutrients, in order to make sure that they're getting something to do cellular respiration, okay, which means that these people often will be losing a lot of weight, okay, at excessive rates, because they're just breaking down everything in their body that they can find for energy. Okay, and one of the symptoms of breaking down fat is called acetone breath, because that's one of the byproducts of this process. So their breath can kind of have this odor that doctors can look for to help diagnose patients. Okay, diabetes mellitus is a really scary disease because it doesn't have a cure. And in some cases, if you're not managing it properly, there's really, really negative side effects later in life. Okay, it can cause blindness. It can cause you to lose limbs and have to get them amputated, because you end up not having blood flow properly to those limbs because of this diabetes and the fluctuations in blood glucose levels. It messes up your circulation. Okay, so right now it's a scary thing in the world, because if you have diabetes, you know that this is something that you're going to have to manage for the rest of your life. So the two different types are either juvenile or adult, type 1 versus type 2. Now, I just wanted to mention, even though it's called juvenile versus adult, some people who are juvenile can get type 2 as well. Some people that are adults can get type 1. They use the words juvenile and adult because the majority of people who have type 2 diabetes get it as an adult. The majority of people that have type 1 diabetes get it as a child. Okay, so we're going to talk about the differences. The main difference is basically what causes it and kind of like how it presents itself, but the symptoms end up being the exact same for both of them. Okay, they're both just not getting insulin for whatever reason. So, causes for juvenile diabetes, it's actually an autoimmune disease. So, their immune system, for whatever reason, thinks that the beta cells in their pancreas are bad and builds antibodies for them and attacks them and destroys them. Okay, if the beta cells aren't functioning properly, that means that they're not able to produce insulin whatsoever. So, if they can't produce insulin, that means that they're going to have nothing to actually trigger the process of putting glucose into the cells or into the liver or into the fat so that we can store it for later or use it up at that moment. So that's why they're going to feel tired. They're going to end up using proteins and fats to get glucose, and they're going to be peeing all of their glucose out because of the fact that they cannot produce insulin. Okay. The other scary thing about diabetes is if your blood glucose levels are going off crazy, you can actually go into something called a diabetic coma and you can actually die from this. Okay. So it's super important that our blood glucose levels are staying constant. Okay. For whatever reason, these people can't do this because of whether it's an autoimmune disease or something else, which I'll talk about. So for someone who has type 1 diabetes, they have to get daily injections of insulin. Okay, they have to monitor their blood glucose levels. If you're someone who has daily injections of insulin that you do yourself, you would test your blood glucose levels and then take insulin depending on how good your blood glucose levels are. Okay, some people have an insulin pump, which is constantly monitoring their levels of blood glucose and giving them insulin kind of throughout the day. So obviously, this is a lot easier to help manage. But it is an expensive technology that some people do not have access to. Something else that people who have type 1 diabetes have to do is they have to make sure that they're really looking into how much carbohydrates and proteins and lipids that they're consuming, okay, and tracking that to make sure that they're getting the right amount of everything and being really careful with their diets because that is going to help them manage their blood glucose levels, which means that they are not hopefully going to have super highs or super lows. Just makes their lives a little bit easier to manage. Someone who has adult onset type 2 diabetes, this is caused more gradually, okay, and it's usually because of sometimes high fat or sugar diets can cause this to happen in certain people. Okay, it happens a little bit more gradual, so not all of a sudden one day you're having this autoimmune thing where you have now diabetes. And the thing that's happening inside someone's body that has type 2 diabetes, you have these receptors on all of your cells that allow insulin to attach because the body cells are the actual target tissue for insulin. And insulin, when it attaches, will allow those receptors to open up and allow glucose into the cells. So, for whatever reason, this person who has type 2 diabetes, the insulin receptors no longer respond to insulin. Okay. Or sometimes in really extreme cases, someone who has type 2 diabetes could potentially have their pancreas stop releasing as much insulin over time. Okay. And the kind of metaphor that I use to think about this is it's like they're constantly putting this high level of insulin out to deal with the high amount of sugar and fat that a person is eating. And then over time, the insulin receptors stop responding, but the pancreas is still releasing all this insulin. And the pancreas is like, you're not even using all this really awesome insulin that I'm making. Okay, I give up. I'm not even going to make it anymore. So then the insulin is no longer there, which then kind of is similar to a person who is type 1, where they might have to get insulin injections depending on how severe their diabetes is. Remember that the symptoms are the same for both. They would be feeling tired. They would be feeling like they're urinating a lot, but they're super thirsty. They could potentially be losing a lot of weight because they're breaking down other things, not just glucose, in order to get sugar. So breaking down their proteins and their fats and organs and stuff to get that sugar. So losing weight because of that. So the treatment for someone who has type 2, it's a little bit easier to manage, especially if you catch it early. So they can really change their diet and change how much they're eating for each meal. Maybe they're doing smaller meals throughout the day, different types of snacks, different types of foods, really making sure that they're not eating as much sugar content as they were before. and really high fat foods as before. So just watching what they're eating, exercising more frequently than they were before, and also they have to monitor their blood glucose levels. Some people will be put on medication to treat their diabetes. And yeah, that's pretty much all. Depending on the circumstances for type 2, it would depend on how severe it is and how far it's progressed. So this is just showing you guys the blood glucose levels of an optimal individual, someone who does not have diabetes, and someone who potentially is diabetic. So I just wanted to mention this because this is important to kind of see. We do have normal fluctuations in our blood glucose levels. So if you notice when we eat breakfast, right after we see a spike in our blood glucose level, okay, and then kind of throughout the day, in the next couple hours, okay, you see a decrease in blood glucose levels. That's because your body would be releasing insulin right here, and then it would be using up the glucose, putting it somewhere, okay, in the cells, in the liver, in the muscles, the fat. And then you have a little bit of an increase right here because then you would be releasing glucagon. And glucagon has the job of taking out the glucose that's been stored in the liver, muscles, and fat and using it back in the actual blood. Okay, and then we eat again. So then we have a spike and then we have that same decrease. You can see that pretty normal fluctuations in someone's day-to-day life. So someone who has the optimal blood glucose levels range between, I would say, like the lowest is around, I don't know, like 70 to about, I don't know, 130, let's say. So approximately 70 to 130 milligrams per DL. Someone who has diabetes might have these spikes, just like we have spikes, but their insulin isn't there to like bring it down. So their spikes are all the way up to like 275. Okay. Ours shouldn't go over 130. If it's going over 130, that means that you have something wrong. Okay, so here's another picture as well. So the different types of diabetes. Obviously, type 1 would be a lot more severe because they don't have insulin at all in their body. So their spikes are even higher than someone that has type 2. That's why type 2 is a little bit more gradual because over time their spikes would maybe get bigger and bigger and bigger. Again, you're seeing that white line is someone who does not have diabetes, and you can see it doesn't get over like 130 is normal. Okay, so I would say that if you look on a graph and you see something that's over 130, severely over, okay, that would be someone who has some type of diabetes, whether it's type 1 or type 2. I just wanted to show you a picture of this. Okay, this mom had a boy, he was 3, and he was really, really, really underweight. You can see how thin his arm is. Okay, super, super sad. She took him to the doctor. They thought that he wasn't being fed properly. And they put him in the hospital, and they were like, you're a bad mom because you're not feeding your kid. And she's like, I swear I feed him all the time. Here's his symptoms. Okay, but he just won't gain weight. They put him on insulin injections because they thought maybe he had diabetes. And after 3 months, this was the same little boy. Okay, so because if you're not having insulin there, they're literally finding any tissue, whether it's muscles or fat or organs, to break down in order to find food for the cellular respiration, so energy for cellular respiration. This little boy was not gaining weight even though he was eating a normal diet. Okay, so he just needed to have that insulin in his body so that he could actually use that glucose that he was eating instead of peeing it all out. And this is what he looked like only after 3 months of treatment for his diabetes. So hopefully that makes sense. If not, please feel free to ask me any questions you have, and I'll talk to you guys later.